and they live such a stressful life because obviously it's such a metropolitan city that we are in right now.
What can they do about this exercise thing when there's very limited time?
Yeah, so we need to act fast, go to the hospital, get treated, and you'll be all right.
Right, Dr. Amna, I think you have asked me enough questions and I have answered you a lot. It's my turn now. So, being a family physician, what kind of patient do you see who may develop heart disease in your practice?
As you mentioned earlier, that we're seeing younger patients now, with high cholesterol, with strong family history of, heart problems, sudden cardiac deaths in their families. And they live such a stressful life because obviously it's such a metropolitan city that we are in right now. People are very stressed at work. They don't get enough time to do exercise. And I advocate for lifestyle all the time to my patients, but it's not really something that they can incorporate in their life, and they're like, oh, we eat whatever, we do takeaways, we can't exercise. So those are the patients that you can anticipate that, in future, not so far future, like a coming future, near future, they might develop something, some cardiac related, heart related problems. And I would then obviously referring them towards yourself.
Yeah, that's right. But I don't know why people are afraid to come to cardiologists. I don't know why. But being a family physician, I think people feel very comfortable to coming to your specialty. And you have a holistic approach, isn't it? That helps. And that's why it's been called family physician, it's friendly, family friendly. Right, Dr. Amna, let's do a bit of role play. So imagine I'm a 40-year-old, no, I'm a lot older, but let's imagine I'm a 40-year-old man having a very stressful job. And I've come to you with headache, I don't exercise, I smoke, I eat junk food, and I've come to you with various symptoms. I'm getting headache, I'm not getting sound sleep, and I'm getting tired easily. What advice would you give me?
So obviously, first of all, you're a gentleman, you're quite young, who's come to me with the stress, as you mentioned, and a bit of unhealthy lifestyle. So to begin with, and also your symptoms of feeling tired, that's something that needs further looking into. So it's just talking about the lifestyle at this point might not be adequate. I'll have to run some tests, maybe some blood tests, take some proper history to ask about you, and also about the family history to know what exactly is going on and to find out the root cause of it. And then start treating it accordingly. So if it's just the lifestyle, because a lot of time it is the lifestyle which is making us tired because we're not sleeping enough, there's a lot of stress. Sometimes it's the deficiencies of some, like vitamin D, vitamin B12, etc., things like that, hemoglobin issues, heart problems, as we are obviously sitting in front of the cardiologist, is there a shortness of breath? Are you getting tired easily? Are you having any palpitations with your stress? What's going on? So I'm going to have to ask further on your cardiac health and then treat accordingly, and if needed, refer to the appropriate place after doing my initial investigations.
Yes, I think that's the right approach. I don't know about you, but I see a lot of people who doesn't exercise much, right? They give excuses because they work long hours.
Absolutely, yes.
How do you sort of try to explain them what can they do about this exercise thing when there's very limited time?
It is difficult in today's lifestyle, isn't it? And a lot of my patients who come, they're doing office-based jobs. So their job is not very active. They're not doing an active job where they're doing a few steps. So I start by telling them that, you have to do the exercise. I know it may not be possible every day, but start with 2 or 3 times a week. Start getting your steps up, like, start moving. When you have your lunch break, get up, get out of your desk, move around. So at least you start like getting 5,000, 6,000 steps and slowly build up on it to 10K steps, as we know that, that's sort of good for your body. A bit of weight training, because that does not require a lot of time. You can do it at home. You don't necessarily need to go to gym. Buy a few dumbbells, 5 to 10 kilos, and do a little bit of weight training if you can. Again, not so much. Just try to incorporate 2 to 3 times a day, and eventually people do start enjoying it, because exercise makes you feel better. So eventually people start sort of, incorporating it and feel like, oh yeah, I'm starting to feel better. My energy levels are better. But for some people, it's obviously difficult, and they just hear it and they can't do it. You can only advocate, or you can only advise.
Absolutely, you have said it really well. When it comes to exercise, need to follow that Japanese thing, developing the habit. Yeah. Do it every day, even if it's for 5 minutes or 10 minutes, number one. And number two, you can do it at home. You don't have to go to the gym. You can use your body as the exercise tool. Do the calisthenic exercise. I tell my patients I do my exercise while watching television, Netflix, right? Yeah. You can utilize that way. So something to do regularly, not for 1 hour, even for 10-15 minutes, slowly develop the habit, rightly, as you have said. Absolutely.
So while we are talking about this heart attack, and we've talked about the symptoms, we've talked about, what happens, shall we talk about when you have a heart attack? What's the treatment for it?
Okay, so I'm going to tell it like a story.
Sure.
So someone is having chest pain, sweating in the middle of the night, right, and in the distress. Don't wait thinking that it's going to disappear on its own. Don't think that this is gas or stomach or muscle. This is serious. Call the ambulance immediately. The ambulance comes, the paramedics does an ECG, assess the patient, give aspirin, very vital, because this can save the patient life. Then they will transport the patient very fast to a nearby hospital. Remember, I told you, sooner the patient comes to hospital and get the treatment, maximum is the benefit, and that window period is 120 minutes from the onset of chest pain. Patient comes to the emergency, the ER doctors see the patient very rapidly and call the interventional cardiologist like me, whoever is on call. They come, explain the condition, take a consent, and then does a procedure. Now this is what is going to help the patient. It's a procedure called angioplasty. Remember, there's a blockage, it's a mechanical problem, and it has to be dealt with mechanically, right? So the heart specialist now take the patient to a specialized area. This is not an operation theater, this is a specialized area which we call catheterization laboratory. The patient will be wide awake, may have some sedation, but it's not under general anesthesia, local anesthesia. We put a tube like cannula either here in the wrist or at the upper thigh, which we call groin. Through that tube, then the specialist send a very long thin tube which reaches the heart, and it's been done under X-ray guidance. So there is an X-ray camera which keeps moving. It's not a tunnel, it's an open camera. So the specialists take pictures of the heart artery by injecting dye through this tube. Once he has identified the blockage, he then passes wire to cross the blockage, send a balloon on top of this wire, inflate the balloon, open up the blockage. Now this blockage can come back, can recoil. So the specialist has to put a tube of wire mesh called stent. This tube goes in, the specialist inflate it, and it opens up. It opens up the blockage and acts as a scaffold. All these phenomena happens very rapidly. Within 45 minutes, it's done. The blood flow is reestablished. The patient life has been saved. The muscle damage has been prevented. And then the patient goes to ICU, stay there overnight, 1 or 2 more days in the ward, and goes home on the 3rd or 4th day.
Right. For everyone listening out there, this sounds like, is it a painful procedure, like, inserting wires and stents and all that? And you said patient is wide awake, so what would you have to say about that?
No, it's not a painful procedure. That's why the patient is awake, but they may experience some discomfort, but during procedure we do tell them. But if someone is having the pain because of the heart attack itself, we have our anesthetist colleagues who look after the patient, give them injection to, not to go to deep sleep, but sort of light sleep so that don't feel the pain. So we have all those arrangements.
Oh, that's very reassuring. Can you shed a little bit light on our hospital, in Fakeeh University Hospital? How are we doing heart attack wise?
Right. Well, I think we are doing very well. The international standard is that the patient should have the treatment where the artery gets opened up within 90 minutes coming through the doors of the hospital, emergency door, 90 minutes. Yeah. We are doing it below 60 minutes.
Oh, that's great to hear.
So yeah, I think it's a great achievement. We are doing this service for the last 4 years, 24/7. Our outcomes are very good as well.
That's very reassuring. Right, now when we are talking about the treatment and the patient has been treated, what happened next? How soon can they go home? What's the recovery process?
Every heart attack is different, but on average, we let the patient go home on the 3rd or 4th day maximum. During this stay, the heart needs to recover. The patient has been seen by the doctor, nurses, dietitian, and then a rehab team. So before they go home, we give them a lot of information regarding what's going to happen in the next 1 week to a month. Remember, it's not only a physical trauma, it's a psychological trauma to the patient.
Absolutely.
Right? So we have to be very gentle, very empathetic to the patient. And I'm sure you may be seeing one of my patients coming to you with some psychological problem. So there are two aspects of it, but we do look after them and follow up them in a week time, 1 month, 3 months, 6 months.
Okay. All right. And as you rightly mentioned, there is a mental health aspect of the, MI or heart attack, because it's such a major event in your life. And yeah, we do see them, and there are some medicines that can be prescribed as well to lift up their mood if needed, and that's something that definitely I've seen quite a lot in my clinic.
Yes. So the message is clear. If someone gets the treatment in time, our objective is to make this patient go back to his normal life as soon as possible.
Yeah, so we need to act fast, go to the hospital, get treated, and you'll be all right. Thank you so much, Dr. Syed Sakib, for giving us such information, such wealth of knowledge about heart attack, and I'm sure it has helped the viewers. So I'm Dr. Amna Khushnud, family medicine consultant, and we're going to end our podcast on this. However, if you have any questions, any queries, please put it down, and we will be able to possibly do another podcast if there are any questions that are left unanswered. So this is FUHCast, and we'll see you soon.